Hello, I'm Tom Beasley. I'm CEO of Active Gloucestershire. I'm here with Siobhan Farmer, who is our Director of Public Health. Hello.
Hi. Oh, it is on.
They're working, which is good. Siobhan, why is physical activity important to you?
So there's two parts to that answer, I think. So personally, it's really important to me for maintaining my own well-being. I think there's a lot of evidence in terms of the link between physical activity and well-being. But professionally, I think a few years ago, the chief medical officers said a quote, which is, if physical activity was a drug, then everybody would be taking it. And I think, that nothing speaks truer about the role of physical activity in terms of the health of the public than that quote. So, yeah, really, really important. I think there's a role for both physical activity and I think what people were saying this morning was movement, but also sport. And I think the two have linked but subtly different importance in society. So, yeah, today's focus is not just on kind of competitive aspects of physical activity, but also just, getting out there, getting moving, doing something.
Thank you. And as Director of Public Health, why is being active important?
Yeah, so I guess, what does the DPH do? What does the Director of Public Health do? So we've got a budget for improving the population's health locally. It's not as big as everybody thinks. And with that budget, we're expected to provide certain key things for the county. So things like sexual health services, public health nursing. We also provide a healthy lifestyle service, which incorporates improving people's health via physical activity. And as Director of Public Health, I also sit on a lot of boards, meetings, which are probably about as fun as they sound. But the role in that is to make sure that the population's health is considered in all of our strategies. So a lot of my role is advocacy, influence, helping people understand the evidence base. And in terms of physical activity, as I've said, the evidence around what it does to both prevent illness and also prolong people's lives and reduce the impact of people's ill health when they are unwell is really, really important. So the team work with the transport team. We've heard a lot about transport today, both in terms of the infrastructure and getting people an access in a county like ours, but also in terms of actually the mode of travel is really important from a physical activity perspective, right the way through to people who are ill and unwell, waiting for perhaps operations, and the role of being, physically well in order to get the best health outcomes possible is really important. So, it spans right from that, what we would call upstream preventative work, right the way through to the role of physical activity in prolonging people's lives and keeping them as healthy as possible.
It's broad, isn't it? And it's huge. And I'm sure we'll have some questions from the audience as well as we go through. On a personal level, I know you're a sporty, if that's the right word, active person. What's your personal journey been with sport and physical activity?
So I was very active as a child. I was never bad at sport, but I was never really good. So I experienced at school quite a lot of, I was never really good enough to be on the netball team. I was always in the B team or the C team. I was never good enough to be on the tennis team. And in fact, I didn't come from a family where I'd learned to play tennis. So in fact, I got left in the corner with about 5 of us who couldn't play with a racket and told to kind of get on with it, while the really good ones got all the tuition and support. So school sport was always a bit of a letdown for me. I was quite good at cross country. Everybody else hated it. I don't actually, again, think I was actually that good. I think everybody who was good at it just had more sense than me and kind of took the shortcut. And kind of stayed and chatted with their mates while I was the compliant one that ran the whole course. So therefore I used to finish fairly high up in the order, but probably, as I say, because I didn't cheat. But I quite enjoyed running as a kid, and I used to do quite a lot of swimming. Swimming was a really big part, and that was outside of school, and I've always loved being in the water. I think it started because my parents used to lifeguard at the local swimming pool, so my dad would lifeguard and we'd go in the pool. So always loved swimming. But was that typical teenage girl, and it dropped off when I was 14, 15. I became conscious of my body. It became something that I found really hard to maintain. And I think quite a lot of pressure around academic study and finding time for it was really difficult. And I've really only picked it back up in my late 20s, a little bit at uni. I learned to row at uni, but again, suffered from the, if I wasn't quite good enough, I wasn't going to get out and get in the boat. So yeah, as I've got older, I've picked it back up, and I think, you know, the things we've been talking about today about, you know, finding the thing that you love has been really important to me. So I've found different sports over the years now, and do a bit of all sorts of things, really.
Thank you. And it just shows, I think sometimes we forget in these sorts of roles that you hold that we're all people and have our own experience with physical activity as well. So we bring some lived experience to those roles ourselves and understanding.
Yeah, and I think, you know, what's been really important for me, particularly with the job that I do, and we were actually talking about to Tom just before about, you know, the workplace and how in the sport I do now, so I'm running. I have a love-hate relationship with running. I love the feeling when I finish. I hate the feeling when I go out the door. It's not something I'm not. My husband's very weird. He loves running. I do it because it's good for me, and I like the feeling afterwards. Swimming, I absolutely love. I love being in the water. So yeah, I think and more later in life, I've picked cycling back up, which I hadn't done since I was a child. And yeah, the freedom of being out on the road and the countryside and and it's quite social if you join a club cycling as well. You get to go for cake. I mean, that's really the only reason I do sport, let's be honest. But you know, most of my kind of injuries and things that I have now when I do my own kind of sport are desk related. So it's because I sit at a desk or I sit in meetings and I've got bad neck. Got a little bit of a bad back today, and you know, from stooping, and so actually, you know, work can be detrimental to our physical health as well, particularly desk jobs. And I think the other thing during the pandemic, a lot of people really, really found that hour a day. Sort of, you weren't allowed to go out, so everybody used that hour really well. Whereas now, I think we've slipped back into, oh well, it's always there, so I can go whenever I want. Does that make sense?
It does, yeah, and it's easy to do, isn't it? It's really easy to do. So, as an anchor organisation, so we use this phrase anchor organisations quite a lot, and I've heard it used in various sort of council meetings. I had to go and look it up, if I'm honest. So the first question is, what do we mean by an anchor institution or an anchor organisation? And then, what role do those organisations have in supporting people to be more active?
Yeah, so an anchor organisation is an organisation, usually public sector, although in Gloucestershire we've been doing some work with big businesses that are anchored in their local community. That's where the term comes from. So they're likely to be there for a very, very long time. So the good examples would be things like the county council, the NHS organisations we have, universities, so things that, you know, will be around for a very long time. And that's why we've also included local employers, because some of them have, you know, really grown up in Gloucestershire and are still going to be here in 10, 20, 50 years' time. They tend to be big employers. They tend to employ a big proportion of the local workforce. And because they're quite big, they tend to have a reasonable amount of spending power as well. So the idea of an anchor organisation is to promote, I suppose, it's almost called sort of corporate social responsibility in a way, but you know, to ensure that the pounds that we spend are spent as best as they can be to benefit the local population, rather than, you know, buying from a supply chain in China, for example, which sometimes is necessary, but there are definitely things that all organisations can do to invest in their local community. So the second part of the question around physical activity. So I think clearly, as big employers, they have a workforce to think about and look after. You know, it's in most businesses' interest, no matter what sector you work in, to have a healthy workforce. And having talked about, you know, how important physical activity is to prevent ill health and to maintain people's well-being overall. And the two biggest causes of sickness are musculoskeletal and mental health, both of which we know physical activity both prevents and helps. So hugely, hugely important that the workforce feels able to access physical activity opportunities, understand that their employer supports it. We probably, I think all organisations, anchor organisations too, probably don't do enough. And I think typically some of the roles will be more physical than others. And I suppose the question is, you know, is that celebrated and, you know, the role of that and the importance of that, but also the impact when somebody gets sick on those more physical jobs and what that means and what reasonable adjustments are in place for people with disabilities, access to the right support and things is really important.
Thank you. And I've got probably my toughest question, and then we'll open up to the audience. How do we know if it's working? How do we know, you know, it's about our collective action, it's across about all the stuff that we're all doing and contributing towards in the room. How will we know if we're making a difference?
So it's a really good question. I actually thought the most difficult one was trying to tell you all what I did for a living, but the impact is quite challenging. So I think, you know, Sport England's, I think Jeanette's still, no, she's gone. She might be downstairs, but you know, the data that Jeanette was advocating to you all is a really important part of it. You know, one of the best ways is that kind of survey data and people's, you know, self-reported interest. I think there are other general indicators about kind of engagement, participation. So, you know, the parkrun movement. I mean, you know, to look at the number of people that were running 5K on a Saturday morning years ago versus now through parkrun, there's actually really good statistics. So, you know, those community kind of projects can be really helpful to understand the overall trends. And then I think it's working with organisations like Active Gloss, who have got that kind of reach into a much wider range of local organisations that aren't formally collecting data. So, you know, the work you do and the team too, Tom, around understanding, you know, what is on offer locally, people's participation, what works, what doesn't work is really important. I still don't think at all in any sector, not just physical activity, we're good enough at the bit about inequalities and understanding what the barriers are and what access is like. And I think Jeanette alluded to some of the data talking about that. But again, you can only draw the conclusions from who you've asked and what you know. So you've got to ask the right people in the first place. So I think it's a sort of combination of anecdotal, softer data about, you know, community participation, and, you know, activation locally, and then the kind of harder survey data. And then the final thing I'll say, you know, there's also kind of social movement it's a sort of organic aspect. So, you know, there's things around how much people are talking about it, you know, how many people you see walking and cycling. And I think, you know, if you compare, we all know it's not hard to guess, is it, that the rates of cycling in the Netherlands are more than in the UK, you know, so we don't need a survey to tell us that one. So sometimes I think there's also something about what we can actually see happening around us.
Great, thank you. Opportunity, does anyone in the audience have any questions?
So my question is around, from my perspective in the role as social prescriber and a fitness instructor and having Health Life Fitness, is there's often a disconnect between primary and secondary care and physical activity providers, be they sort of national chains like Pure Gym, Nuffield, or local or small organisations. I think in Gloucester locality alone, there's about 14 different physical activity providers, and it's often that from an NHS perspective, we're not talking to those people to develop links. So one of the questions would be, how can we do that? And the second part of that is, while there are funding opportunities for charities and CICs, for other organisations that want to get involved and help promote physical activity, it's very, very difficult to get onto that ladder to engage with the NHS.
Yeah, so both kind of quite tricky conversations. I suppose I'll start with kind of a caveat, which is whilst I think kind of gyms and things are important, the importance of the non-formal gym setting in terms of physical activity is also vital. I personally, despite doing quite a lot of sport and physical activity, still really don't like gyms. They're not an environment that I enjoy. I can use the machines, I can do the weights, but it's just not something that speaks to me. And I think, you know, some of the examples about actually what people enjoy is the connection and the talking to others and the, you know, going for a walk and then having a coffee afterwards. The 5K, I think somebody on our table was talking about, they do a 5K run with a particular age group of men, and then they sit and they have a chat afterwards. That's, you know, an informal setting that's I think as important as some of of the formal chains. I guess there's, things we could think about doing around connecting with them. If it's, something we think is important, we could speak to colleagues in the NHS and work out if we wanted to reach out to them. I suppose we'd have to be clear on what the ask was in terms of that connection. And I think the challenge is that profit making and healthcare don't always match, sadly, in the UK. And I think, there's probably more to appeal to in terms of their corporate outreach as well. And then the bit about the funding, it's always a challenge. There's a finite pot nationally. The competing priorities in terms of what calls on that pot are really, really tricky. I think, again, the role of Active Gloss and what they've managed to leverage into the county in terms of additional Sport England funding, etc., has been really important. But I think it's just an ongoing chipping away, making the case for the importance of physical activity and that grassroots investment. Sorry, it's not a magic bullet to answer the question, but I guess it's recognised and we keep trying to challenge it.
So my name's Hannah. I'm the head of Healthy Communities for Freedom Leisure, and I think this is a conversation, not necessarily a debate, but I guess it's just looking at our leisure centres that we've got. We are really trying to open the doors to those people, and it is kind of beyond gym and swim. Healthy Communities is about health and wellbeing and how we can kind of engage with the wider community to come and use our centres, and we're really trying to kind of build that up and make them into health hubs. And I guess the question back to social prescribers is how do we connect with you, and how can we better kind of learn to do that, and how can we connect in with public health? And obviously, now funds have been kind of devolved. It's just kind of, I'm trying to have those conversations with public health in lots of different areas. And what one piece of advice would you give me to knock on the door, and what messaging should I kind of be coming with, essentially?
Yeah, and I think that is a good question back, isn't it? I think quite often picking up the phone or sending an email just to say, how can we help, what can we do, is a really, really good suggestion. And I didn't mean to imply that all gyms were single-minded, but some typically have a kind of more traditional model than others. And I think clearly one of the things in Gloucestershire, of course, is that the county council don't operate leisure. It's operated by the district councils, so our relationship with the district councils is really important. And as Director of Public Health, we're following COVID. Clearly, we had a little bit to do during COVID. So following COVID, we're now reconnecting with the district councils around the leisure offer and what that means in terms of those wider outreach aspects. And I think you're right, particularly gyms that see themselves as an asset for the community have that ability to do that wider outreach, and the less traditional sort of gym body lifting models, I think, are definitely an option. So I guess, I think we're always open to suggestions. I think the one thing, sadly, we don't have a lot of at the moment is funding. It's always going to be the challenge. But we've got passion and time and, ability to advise and connect. And even if the conversation doesn't go anywhere, it's worth trying, isn't it? So, I'm fairly easy to find at the County Council. It's just my first name dot second name at gloucestershire.gov.uk. In fact, I've just given you everybody in the council's email address. Email us all. It's fine. I think, the only emails I delete are marketing. If it's a conversation that you want, we can work out the best way to do that.
One over there.
Time for two more questions. If we take them both at the same time. Sorry. We've got time for two more questions. If we take them both at the same time with Gemma and then somebody over here as well, and then if you don't mind doing two in one, is that all right?
He's now testing my memory as well, isn't he?
Hi, Siobhan. Gemma Arts from NHS Gloucestershire. My comment/question is more about my experience as a mum. And I've just observed, so I've got a daughter who's just gone into sixth form. And you were talking earlier about your experience around how often, and I think it probably is for both, but particularly for girls, how that exercise really drops off at that sort of 16 to 18 kind of age gap. So either if they have been involved in a club, maybe they're not at that level where they're going to keep competing, so it drops. So she's had that experience with swimming. But also compulsory PE stops in sixth form. And I just wondered if you had any thoughts about that, because I was quite surprised. And what her reflection to me is, well, unless I'm in the handball team, or if, actually there's no PE anymore, and then obviously they're busy outside of school with their studies and so on. So I just wondered if there was any thought, because so much happens in primary school, so much happens all the way through, and then suddenly this drop. And I suspect then we've potentially missed quite an important opportunity in really embedding that in young girls' lives.
It's like Challenge Annika, especially with videos running behind her.
Mine sort of links with the question about school and the gym thing. I think there's quite a lot of non-commercial gym type places, which I run one of. So it's a private studio, and we are very different. The reason I do what I do is for physical health and mental health. And I think quite often the commercial gym try to portray that of it's for losing weight and it's for building muscle. And obviously exercise, we know, is essential for everyone, not just for those things. So for me, it's very much around mental health. So how can we have small people like myself and this gentleman here who asked the question, who are the smaller places who's trying to change that, where people come into the adult place and they go, I don't like the gym, I don't like exercise, because when I was at school, burpees were used as punishment. And now you have a whole generation hating burpees, and they're actually really lovely.
No, they're not.
They can be. But yeah, it's just trying to change that mindset and trying to connect people with those places who are a different setting. Because the people that come to me are the people who find the commercial gym intimidating, worried that they can't, not sure if they're doing the right thing the right way, are they going to get injured? All our sessions are coach-led, so there's always someone there to help and guide them, and it's a really friendly, welcoming community where people are having conversations, they are chatting in between and after sessions. We do community walks and all of those kind of things. So how do we go from where the younger ones either hate sport or they stop doing it at a certain age, or like my daughter, she plays her heart out in netball and she gets awards for always turning up, but she's not the best player in the team. So how do we change that, and how do we make those connections to get people connected with the different things? I provide bungee fitness, which is so unusual, and there's not a lot in the area. I provide that for young people and adults. I provide postnatal fitness for mums with babies. How do we connect us with the NHS? I work closely with them. I run a program for them at the moment for pelvic floor, but there's still that struggle to connect and get the word out. So how do we get better at that?
If I knew the answer to that, I'd be Prime Minister, wouldn't I? So I think, just to take Gemma's question first, the statistics absolutely are the drop-off in women and girls, or girls, is much greater than in boys. So yeah, it definitely is a trend. I think it's changing a little bit. I think society-wise, and that's where I think the role of sport can be important because of the role modelling. I think, I'm not a football fan, but the whole kind of country getting behind the Lionesses, for example, I know has inspired a lot of young girls to try football when they perhaps wouldn't, or allowed girls who are in football to feel that it's legitimate. So I think that's quite important in terms of that role modelling. But I think probably what's more important and links to the answer to the point there is, how do we change it from being seen as physical activity being about losing weight, muscle gain, that kind of narrative, to it just being something we do that's really important for our health? How do we shift the narrative from, actually it's just as important if you go out and garden and you get a little bit out of breath digging up your beds to plant your planters up in May, is just as important as somebody who's going to go and do that 5K on a Saturday morning. So I think that for me is the question, is we need to keep all of this kind of work around how physical activity, no matter what that is, vacuuming the house counts. It really does. And if anybody that does that regularly, they know that, it is a workout. So I think that for me is what it is. And I wonder, in terms of the schools question, is, have we got too much focus on compulsory PE? where's the focus on all of the things that happen outside of compulsory PE? And the Daily Mile, to some extent, is trying to do that. It's trying to recognise that, it's not a formalised piece of sport or physical activity. It's, something that the children do together, and it's that connection. And I guess for me, the question is what... it links to the anchor organisation question in terms of, what else exists. I think one of the things we lost in COVID was, Gemma, at Sanger House, there used to be a running club, didn't there? So, okay, again, that's running, but, people connected around physical activity. There was a yoga club in Shire Hall, which I don't think has happened again since the pandemic. So, that there are opportunities for that informal, that are more social connections. And perhaps that's the key to this, is, how do we promote it as a social thing to do, and the physical activity is secondary, as opposed to it being the primary reason to do things. Answers on a postcard as to how we get that narrative out there and change that, both as a society and locally. But I think the more we keep pushing, the more each of you keep that message in mind, the more we'll make a change.
Thank you. I can see
the mosquito in the tent.
Yeah, there's lots of eagerness for other questions, and we're actually out of time, unfortunately.
I'm around.
Siobhan's around, I'm sure, happy to connect and to take further questions, so thank you. Today is about saying thank you, as well as about celebrating what's happened in our county. So it's a great opportunity to say thank you from everyone for the work that you've been doing as Director of Public Health, but also with other integrated care service partners, many of which are here today. So thank you for everything that you do. It makes a massive difference, and you're going to be around to connect with other people, I think.
I am, but before everybody finishes, I feel like a fraud. It's not me that delivers the work. I've got the privileged position of sitting and watching what all of you do. So it's fantastic to be here, and thanks for inviting me. So it's definitely, not thanks to me. It's thanks to everybody else in the room, and you in particular, Tom. Thanks.
Pleasure. Thank you.